Okay, so there's another video on what is happening during my doctor appointment. Um, is to what I said in the last video, which is an update from after being suicidal. I was talking about this man in the room. Well, I don't think he's very happy that I mentioned him. But anyway, what have been happening is that my psychosis is, it's like, well, back then it was like I was causing suffering to everybody, seriously everybody. Like, that's why I ended my friendship early, because my existence being there would actually kill people. So, and then this time, I don't know, my doctor says delusion, like, I feel like somebody's making me do it, or that I have to do it, or sometimes I hear sounds, or I hear people talking, not talking to me, they're just saying things or whispering, which I can't really make out what they're saying. So basically, yeah, so, my doctor appointment. My doctor appointment is, right now it's happening every Wednesday, because ever since I got back from the Singapore trip, I have been kind of getting worse. It's adjusting my medication, along with the so-called CBT, which stands for Cognitive Behavioral Therapy, which, to me, it's not working, or her style is not, it's not for me. Whatever, she's like, if you don't want to take med and you're not cooperating in CBT, then, well, I can't do anything else for you. Oh, thanks for that. And then she's like, oh yeah, she was saying, it's my school stress that's causing all this. Ever since I got into university, kind of like 2 years ago, she said that, she's saying that I have never gotten better. Like, back then, before my university, I was still coping a little better at times, although there are times that I did worse. Like, every time before exams, I would kind of panic and get stressed out and suicidal, and what happened afterwards is that I would end up in hospital. Either I have to try to make my way out to attend the exam, or basically just withdrew from the exam. Either way. But then I don't really agree with her, because what happened is that nothing has really changed that much. It's not exactly like I was better before I got into university, and she was saying my psychosis only started after I got into university, which isn't true, because it started when I was inpatient for 3 months during that time. It was a manic episode, and it was bad because it was worsened by Prozac, which I was taking at that point of time. Back then, it was before the diagnosis of that bipolar, so they thought it was depression, and they just gave me antidepressant, just Prozac itself, and it made my mania worse in the hospital. So they changed the diagnosis, and ever since then, yeah, so that was my first psychotic break. And afterwards, that time it was before I got into university, so whatever she said doesn't make sense. And then, yes, I do agree that my eating disorder hasn't gotten better, because back then there were times I would fare better, I would be able to maintain a higher weight and, eat better. But ever since I got into university, it has been that way. I have stayed at the lower end of the scale. I don't know. Yeah. So she's saying that I have gotten into hospital at least once every year I enter university. That is true, but before that, I was going to the hospital a few times a year. Yes, it was. Because I was worse than where I'm now. Really impulsive, relationship problems. Not boyfriend, girlfriends, but like with people. And I was suicidal. I attempted suicide a few times. Yeah, she's saying like, if you don't do this or whatever, or basically what you're doing now, it's that the stress of going to school is causing you all this. If you can't deal with it, then let's resort to the most pessimistic alternative, which is, you quitting school. I know there'll be stress along with that, along with not completing school and stuff, but maybe it's better that you don't have the stress of studying law. And, well, I don't know. What is she saying? And plus, the problem is, my appointment is carried out in Cantonese. And I'm not good at expressing myself in Cantonese. So during the session, most of the time, I am mute. And my mom would be like, why are you so quiet during the session afterwards? You talk so much now. Or like, you have so much to say, why don't you say it in her face? Okay, but then I just didn't know how to say it. It doesn't come out that way. It isn't in my mind to translate at a point of time. And then also last week, because I feel like killing people, like really, really bad, I want to do it. And then so what happened is that I show her everything that I've drawn. Maybe I will show you like another time. And then she's like, oh, so what happened now that if you didn't hurt your mom or didn't kill her mom, didn't do anything to her, you didn't do anything to me, which is her, and then you didn't do anything to yourself. Well, that is not a hypothetical question. That is not, because it has happened. Like, the tsunami has happened and you say that, oh, so what happened now that tsunami hasn't come? That isn't the case. I've heard my mom, I hit her before. And then also, I have tried to hurt my dog, or I try to kill my dog or whatever. And then I haven't tried to kill myself. I just bruised myself, like if I show you in the last video. So whatever she's asking doesn't make sense. The real hypothetical question is, what happened if I kill you now? That's what I was thinking when I wrote my journal. So I was like, and then I was having these images of stabbing her and, holding a knife against her neck. I'm not sure if I should tell her, but then again, I'm going impatient soon. This video is really long, I'm sorry about that. So it's probably gonna be uploaded in standard version. I'm sorry, because my phone can't do high definition when it's this long. So anyway, bye.